Hello, welcome to Doctor's Hospital. I'm Elizabeth Adamson, Vice President of Information Services at Doctor's Hospital at Renaissance. I am also the Chief Nursing Information Officer responsible for the Clinical Healthcare Informatics Division at our organization. Clinical Informatics. What do we do? What is that area? It's also known as Healthcare Informatics. Clinical Informatics promotes the understanding, integration, and application of information technology in healthcare settings. More and more often, clinicians and physicians are using technology to assist them in the delivery of patient care. You may have heard about meaningful use. At our organization, we've successfully attested for meaningful use stage 1 and meaningful use stage 2, but we are now in the process of talking about beyond meaningful use. We don't want to think just about meaningful use, meeting metrics and meeting the criteria designed by CMS. Although we do want to do that, we also want to make sure that it's a meaningful experience for the patient and for the providers. We want to transition from meaningful use to meaningful care. We want to be able to leverage information technology to improve the end user experience and clinical integration. We want to optimize the delivery of patient care through a single platform strategy and eliminate the fragmentation of documentation to improve care coordination. We want to explore innovative opportunities to become the industry leaders, not just in South Texas, but in the country. So one of the main roles that our department does is support the electronic medical record. So when you join us here at Doctor's Hospital at Renaissance, you will be receiving a training session specifically on how to use, navigate, and make sure that you're effectively using our electronic medical record in the process of patient care or in the process of planning for patient care. We here use Cerner Millennium. It is one of the best electronic medical records in the country. We provide real-time access to patient results and clinical information across care disciplines. It enables healthcare organizations to meet the Joint Commission requirements for patient confidentiality. We are able to access patient information securely from wherever and whenever it is most convenient for the care team. So that means that providers and clinicians, when needed, can access the patient information not only from the bedside, from the nurse's station, from another floor, another department, or outside the organization. We want to support the patient care delivery process and make it that it's able to navigate and travel with you. So what is the electronic medical workflow? We want to go ahead and share with you which areas are electronic, which areas are in the planning phases, and which ones are on paper. As we navigate through this hybrid environment, it becomes important to understand where the documentation can be found. So here we have an actual visual aid to go ahead and assist you with the different areas of the hospital system and the different electronic solutions that support those systems. In the next few slides, we'll go ahead and give additional detail to support this slide. So this is our electronic medical record current state. Which departments are on Cerner? Now remember, Cerner is our clinical information system, our core system throughout the organization. So as you can see, several acute care areas, including our main patient care areas, emergency department, ICU, pharmacy, lab, are all on the same platform. This is important as we begin to document and talk about data exchange and interoperability. These areas, as seen on the slide, are not on Cerner. And so this can be challenging at times, but we are confident with the training and the right guides, you will be able to navigate throughout the organization and the system successfully. And so these departments are still on paper. Now, they're on paper today, but it does not mean that they will be on paper tomorrow. We have a plan right now, and we're working through the timelines to go ahead and convert and begin implementation to get these areas on a single platform. What are some benefits to the electronic medical record? Well, as the patient comes into the organization, not only will you have immediate access to that encounter for that admission, but you'll also have electronic access to previous encounters in that same record. So just by a click, you can access the record where the patient's been here before to help you make clinical decisions. We increase efficiency by placing real-time updated information with the care team to make fast and effective decisions. we increase access to information from multiple venues in the healthcare system to assist all the providers and clinicians to make educated decisions as well. This slide gives you an idea on how we measure the different specialties. Although it doesn't include everybody, it's an indicator of how we measure not just individual physicians, but we also aggregate their scores to measure them collectively. So this next slide talks about the CPOE impact by specialty. It is important that everybody engage and adopt the system and use it effectively. As a result, you can see here the different providers by specialty, their denominator of total orders, and the percentage of contribution that they contribute to the overall CPOE score to our organization. Every specialty, every physician, and every order counts. So CPOE, you've heard me mention that, the computerized provider order entry. Many of you have probably already been exposed to this before, but if you haven't, don't worry. We will be reviewing this during your training class when you join us on site. We're provider-centric ordering. We also have a medication management ordering system to be able to streamline the appropriate medication selection and management. We also have an electronic medication administration record, so as soon as a clinician or nurse medicates your patient, you have real-time access to that information. CPOE saves time by eliminating the duplicative process and allows the clinician to articulate care from anywhere, anytime. It reduces medication errors and adverse drug events. We've seen this improvement at our organization as well. So we're also going to discuss PowerNote. What is PowerNote? PowerNote is a Cerner application for documenting the healthcare encounter and creating an electronic record of that encounter. Think of it as digital documentation for the physician. Your HMPs, your consult notes, your progress notes, all of those are electronically captured, making them available for other providers to see them real time, including clinicians. We want to improve the care coordination and communication amongst the disciplinary teams. Using PowerNote, you can complete an entire patient encounter, including reviewing results, writing documentation, assigning a diagnosis, and initiating a care plan or placing orders. There are several requirements for HMP notes. And so this will also be discussed during your first day of computer training with us. During your computer training class, the Chief Medical Information Officer and Health Information Management Director will also be there to ensure they review and communicate what the required elements are, not just for Joint Commission purposes, but also according to our hospital policy and bylaws. There are several benefits to using PowerNote, and listed are just a few of them. Documentation is completed during the encounter. It eliminates delays, and other providers and clinicians can access that information in real time to help them make real-time decisions. Documentation is completed by the clinician or physician, eliminating the need for medical transcription with its inherent cost and time delays. The notes are accessible electronically to all the other clinicians in your healthcare organization, and without the time and effort required in transporting hard copy medical records from one location to another. Activity data can be analyzed easily and quickly for patterns in treatment, patient demographics, vital signs, and so on. This next slide lets you know where you can get additional information at our organization and how to use PowerNote. But this will also be discussed in detail upon arrival during your EMR training session. However, if you want additional information prior to arrival, please visit us at www.dhr-rgv.com, and you'll notice at the very bottom of the screen it'll say Physician Resources. Please select Physician PowerNote Training. And then you'll go ahead and get some additional information, and you'll see on the left-hand side, as seen on the screen, how you can get the information to be able to start reviewing it prior to your arrival. Power plans. A power plan is a set of orders grouped together. This can be considered order sets, order profiles, or protocols and policies, and we're going to review the difference during your training session between a power plan, a protocol, evidence-based practice, and guidelines. And so those are all under current review at this time. So by the time you join us, we'll have additional information to be able to share with you. Favorites allows a user to make customizations to an order, a power plan, or a power note. Physicians can review orders or frequently used orders and put them in a folder where they can label themselves to whatever they want. Then they can have access to that and be able to retrieve it at any point to save time. This functionality greatly reduces the number of clicks it takes to complete your task. Templates. Much like the favorites, physicians are able to customize frequently used documentation templates to go ahead and meet the needs. Although our Chief Medical Information Officer will guide you and provide additional support, the functionality does exist in the system to assist you and navigate through the process. Patient lists and filters. Patient lists help organize a large amount of patient data, streamlining how the data is viewed. We want to make sure as you retrieve a patient list, it's a meaningful use that assists you as you're rounding on patients and documenting on them. Patient lists can be viewed using a customized criteria, patient location, or provider relationship. By building a variety of lists, patients can be grouped together by logical categories, making it easier to locate a patient's chart instead of relying on a large single list. This is probably one of the most frustrating things for physicians when their patient list is not configured properly. We will assist you during your orientation process to ensure that you understand how to customize the list, and also assist you during the training session to actually customize the list to make sure that you're ready for your first rotation. Medication reconciliation is a very important process at our organization. And it's not just one person that is responsible for that, it's everybody. It's pharmacy, it's informatics, it's nursing, it's the physicians. Everybody must contribute and complete their part for this to be successful. Medication reconciliation allows you to reconcile the medications that you want the patients to discontinue upon admission, transfers, and discharge. During your training session, we will go ahead and use scenarios and simulation training to make sure that you understand this process. Medication reconciliation is audited on a monthly basis, and feedback is provided to physicians to go ahead and let them know where their areas of opportunities exist. Continuing inpatient medications upon discharge will create a prescription upon signing. And here you'll see a screen from our electronic medical record in our test environment of what the screen will look like and how it displays once a medication's been documented by history. And this is another screen of the order reconciliation process. Although this screen may not make sense, you will be seeing it again, and you'll be navigating through that, and you'll be getting an opportunity of hands-on training to be able to practice this. Here's another slide as well for the transfer. The transfer is important when patients are transferred between units or from different levels of care. The same for discharge. It is important that reconciliation take place not just in admission, but also at transfer and also at discharge. Failure to do so will only delay the process the next time the patient comes in. We want to make sure that patients understand and it is clearly communicated to them what their medication plan is upon discharge. Status admission criteria is important as well. Oftentimes patients will change from observation or inpatient status or back and forth. So when that happens, we want to make sure that we actually have the order to support that. You may receive one of several different alerts designed in the system to aid you in the process. And you will hear more about this from our Clinical Documentation Improvement Manager and also our informatics team during EMR training. We want to improve the physician experience, and that includes your experience as well. M-Modal is a voice-to-text recognition software that enables physicians to dictate directly into a patient's chart. So as you're practicing using electronic power note, which is the documentation that we use in Cerner, our information system, we also have a voice-to-text software that you can actually talk into a microphone to help assist you in that process. You will also be receiving a user ID and password during your first day of EMR training, and you will be getting a hands-on experience to go ahead and practice this during that session as well. We will determine prior to your arrival if you will be receiving a DHR email account. Physicians use these to be able to communicate securely with their peers. Our technical team will also be available to assist you to make sure that you can access Cerner and any other necessary applications from any iPads or mobile devices. Single sign-on allows the physician to use their DHR badge to log into workstations seamlessly. What it does is it allows you to go from workstation to workstation without having to log in and out by simply swiping your badge. This makes it more effective and saves time so that your physician does not have to log in and out. Minutes count, and we know that. You can swipe your badge at any single sign-on enabled computer, enter your password, and access your clinical applications. Once you've logged in the first time, you can swipe in and out of workstations over the next 4 hours without being asked to enter your password again. Meaningful use. We discuss meaningful use as we're transitioning to meaningful care, but we want to make sure that we monitor both areas carefully. As we discuss meaningful use, it's important to recognize and understand that Doctors Hospital has met meaningful use stage 1 and meaningful use stage 2 successfully. We are currently in our 2015 meaningful use stage 2 year 1 attestation period. This slide reviews some of the objectives that we monitor on a daily basis and report up to our board on a monthly basis. Physicians have done an amazing job entering orders electronically, and we know that with you on site and your support, we will continue to improve. If at any point you have any questions regarding meaningful use objectives or how to help us meet that criteria, please reach out to anyone on the clinical informatics team and we will assist. Here we just have some additional information and then where you can also find some additional information in case you're interested. Visit www.cms.gov. And we know that once you join us, although you will receive the CD and you'll get a high-level overview of what we're going to be doing, you'll also be scheduled for on-site electronic medical record training, where we will go ahead and navigate the record in more detail so that we can improve your physician experience while you're with us. But please note that support doesn't have to stop there. Our team is just a phone call away, and we also have a 24/7 service desk ready to help. If you have any further questions, please feel free to reach out to me, Elizabeth Adamson, and I can be reached at 956-362-3015. Thank you.